Hello, everyone. I am delighted. Hello, everyone. I'm Sandra Crewe, Dean and Professor of Social Work at Howard University. I am delighted to share this time with you today to talk about social isolation and mental health in the Black community. I have titled this presentation, Staying Connected. I know that some of you in my listening audience remember the Al Green hit, Staying Together. Well, it provides context for me to discuss this very important topic with you today. You know, the Al Green song states that whether times are good or bad, happy or sad, come on, let's stay together. So the presentation today focuses on the importance of staying together, thinking about social isolation and what that means. So, again, this is a part of the Howard University School of Social Work mental health series focused on the struggle is real. So, as we begin to think about staying connected, that has a different meaning for all of you. So, as you think about it, I want you to reflect during this session. What does it mean to you? So again, I'm so grateful to have this opportunity to collaborate with blackdoctor.org on this particular series as we think about mental health awareness. And the Howard University School of Social Work embraces the importance of mental health awareness. Again, the session is focused on affirming the strengths and improving the quality of life for families, individuals, friends, community, victim kin, others. It is about all of us really thinking about how do we move forward in today's climate. You know, we're facing so many challenges and so many struggles today, including escalating gun violence. Aren't you just emotionally exhausted when you turn on the news and you hear about the loss of life? We're dealing with Supreme Court decision that's upcoming today about affirmative action. And you really think about the struggle that our ancestors had in making sure that we had the right to go to college, the opportunities were afforded to us. And today we see the Supreme Court decision will be issued related to that. And we think about reproductive rights of women, another area of challenge and focus for us. You know, I think you would agree that the struggle is indeed real. However, you know, not only is there struggle, what comes with struggle is hope. And I am grateful to be a part of the trusted messengers that really help us to realize that there is hope and help out there. Certainly, 988 is a number that anyone should call if you're feeling stressed or you think someone else is stressed. We want to make sure that they get the help that is needed. So, as a part of the Howard University School of Mental Health, School of Social Work mental health awareness, we want you to know that help is there. Well, you see, I have my Shiro in the photograph here on the screen, Harriet Tubman. You know, I really think of Tubman as the premier trusted messenger as it relates to mental health and mental well being. You know, as we think about Harriet Tubman, I see her stretching her hand out for us to really grab onto one another and stay connected. So I use that often as I think about how do we stay connected as it relates to mental health in our society. One of my favorite Harriet Tubman quotes focuses on her stating, I had crossed the line, I was free, but there was no one there to welcome me to the land of freedom. We all individually and collectively have the responsibility to welcome someone to freedom. And in my assessment, freedom can mean freedom from stress, freedom from the sense that you are out here all alone. Freedom can mean that we are really focused on one another and trying to build a better community. So, again, I would certainly suggest that you think of Sister Harriet Tubman and the message she gave us, that she not only found freedom for herself, she went back and she brought others to freedom. That is our responsibility as individuals. We have a responsibility. Thus, this session is really to help us focus on how do we recognize social isolation as it relates to mental health, and as we move forward to make sure that we're not only concerned about ourselves, but we are concerned about and for others. So today's presentations will give you some insight on social isolation and really what it means. So as I begin to sort of think about social isolation, we've heard a lot during the pandemic about social distancing. I've consistently said that we really need to change that to physical distancing, because we did not want people to socially distance from each other during COVID. It is really important that we as a community understand the impact of social isolation. And perhaps I would say the impact of being socially connected. So if I would use the Howard University School of Social Work Black perspective, I would think about affirming the strengths of our community. So if I affirm the strengths of our community, I really think about the power of being connected. Remember, I started with the song of Al Green, "Let's Stay Together." Well, social isolation is what happens when we do not stay together. So today I'm going to talk a bit about social isolation, but I'm going to break it down so that it is not only using a term, but understanding what the term really means and really using that understanding to help others. You know, understanding something only has value when you use your understanding to help self or to help others. So today I'm going to talk a little about social isolation, what that means, objective isolation, and then I'm going to talk a little bit about how do you assess it and what are some of the things you do to intervene. Another way of thinking about intervention is to make a difference in the individuals' lives that we serve. So, again, it's really important that we have a notepad and think about what can I do to make a difference, to have someone become socially connected. It's in your hands, just as you saw Harriet Tubman. It's in your hands to make a difference. So let me kind of digress a moment and talk about COVID-19 and its impact. I know that you have heard this repeatedly during various series, but I wanted to emphasize the impact of the COVID-19 crisis on African Americans and other minoritized populations. Did you know that 13% of the US population is African American, but there was an 18% of the deaths were African Americans during COVID-19? And that doesn't count the impact that the deaths had on families, the mental health impact. I want you to kind of reflect upon that as a moment. That although representing 13% of the population, 18% of the deaths were associated with being African American. One might ask, what's COVID got to do with it? Well, COVID had a lot to do with amplifying the health disparities that were already in the African American population, the economic disparities. COVID really exposed those in a way that we had not seen before. And as a result of that, we also found that mental health problems have increased exponentially. Yes, it is associated with the gun violence that we are seeing in our community. It is associated with the violence across and within families and outside of family, increased domestic violence, interpersonal violence. COVID placed a strain on us individually and collectively, and it strained our relationships as well. Do I wear a mask? Do I not wear a mask? And all of those kind of things really, really made a difference. When we think of historical practices that really demonstrated inequities in healthcare, we recognize that COVID really helped to again reveal these existing societal inequities. Family members were lost, as I said. And, before I continue, let me just take a moment to acknowledge that loss. Join me in a moment of silence and recognition of the lives that have been lost. Thank you. It is always important that we take that moment to recognize the pain and the suffering that someone may be going through. I know it's not all COVID, but as we think about social isolation, we cannot think about it without connecting it to grief and loss. And I know my colleagues have already presented on topics such as grief and loss, how we experience those during holidays. We just celebrated Juneteenth, and some will move on to July 4th, has a different meaning for individuals. But what it often does, it has us to remember a different time in life, moments of enjoyment of families, and those members may not be any longer with us. So, thinking about grief and loss is really so important as we think about social isolation. Families have become fragile because of COVID. There is psychological and physical health frailty that we should think about. So let's really think about how we can continue to stay connected as we really focus on the importance of masking when necessary, of really re-entering society. How do we begin to think about how we do this safely, but also how we maintain being socially connected? So let me kind of talk about subjective isolation for a moment. Again, we usually throw uh, social isolation into one pot, but it is much more complicated than that. So when we think about subjective isolation, have you ever heard of the phrase lonely in a crowd? Lonely in a crowd. Well, what that really means is that it is the perception, not the reality. It could be reality, but it's often perception. And that means that I don't have the support that I need. My subjective experience is that nobody cares about me. I am here alone. That there's an inadequacy in my intimacy or my companionship. So that's subjective isolation. In short, it means how I feel about my connections in society? How do I feel about those select connections in society? And I'm going to talk a little later about there, four types of loneliness that we experience. They are emotional, social, collective, and existential loneliness. But before I do that, I'm going to move on to not just subjective isolation. I'm going to talk a little bit more about objective isolation. Well, how does that differ from subjective? Well, subjective isolation is how I feel. How do I feel? I feel lonely, even though I may be in the midst of a crowd. I don't feel that anyone cares for me. Objective isolation, you measure differently. It is truly the lack of contact. It is meaning that I don't have contacts, I don't have networks, I don't have interactions. It is something that I can truly measure differently. Objective really talks about the number of my connections, how often I participate in things, whereas subjective really talks about how I feel about these relationships. Again, really important to differentiate the difference. As you know, the solutions have a lot to do with the assessment of what the situation is. So before we just simply say someone is lonely, I think it's really important that we think about it and understand it a little bit more. Fortunately, programs like this and the resources of blackdoctors.org gives us the opportunity to learn more so that we can be much more effective and working with individuals. And also, the individuals includes ourselves, by the way. Certainly, it is not just others sometimes that we need to help. Mental health includes our own health. I often say it's a checkup from the neck up. You really need to sort of self-examine and be aware. If you're experiencing objective isolation, why? Why am I not connected? Are there opportunities for me to be connected? These are important questions for you. So, again, as we go through this presentation, I really want you to spend some time thinking about how you can help self and help others as we think about the importance of social isolation and our mental health, particularly within the Black community. Another area is social exclusion, which is an area certainly that racism falls within this whole area. When individuals are constantly reminded that they are not good enough. I found this graphic on Washington Post that really kind of talks about the oppression of racism and how it can make one feel not good enough. When we think about xenophobia, homophobia, all of these things really result in individuals feeling socially excluded. And when one is socially excluded, there can be a sense of not good enough, of being isolated. So, thus, it becomes really, really important for us to think about what it really means when one is socially isolated and how it really does impact our health. Again, as we think about social isolation, we have to think disaggregated so that we're getting a sense of the various dimensions. So as I move forward, I want to, just go back and revisit areas of social isolation and social loneliness. I talked about there being four areas. One being emotional or intimate loneliness. That is the loneliness when one feels that there's no one to talk about something going on in your life, but you feel that you want to talk with someone, but there's no one to talk about. It is a lack of intimacy. The slide that you're looking at really relates more to what the impact is, but I really want you to kind of hear these four elements of loneliness. Again, the emotional uh, loneliness, the type of loneliness that talks about the lack of intimacy or intimate relationships, including affection and closeness. The second one is social or relational loneliness. And this is defined as a feeling of not belonging or not having satisfying personal relationships with family members, friends, and neighbors. It's not only the individual and intimate relationships, it's also the social and relational uh, connections that matter when we're thinking about social isolation. The third area is collective loneliness. This type of loneliness can be explained as a feeling of not being valued or belonging to a broader society. It has aspects of social exclusion or connectedness as we think about it. If we don't feel that we are a member of a community, then we can experience loneliness. Back to the Al Green song, Let's Stay Together. Let's be reminded that despite the challenges, being together is greatly important for us. And as we look at collective loneliness, it's when we again there's a sense of a lack of community of shared identities. This could be the lack of shared identity because you could be a parent and your experiences are different. Or you could be a grandparent raising grandchildren, and the other grandparents in your network don't have to rear their grandchildren. You could be an adult and you have no children, and you are not connected with your other friends who have children. So it can be in various ways as we think about collective loneliness. It could be that you are not a member of a sorority or fraternity, and you're seeing the great fun that they are having as memberships, and you feel that you're not socially connected. All of those things have to do with collective loneliness. And then there's the existential loneliness, and that is a sense that purpose, you don't have a purpose. You've lost your purpose. Without a substantial meaning, a personal meaning, we really are not able to connect with the identity values that we really ascribe to. So we will see that we are disconnected in ways. So all of these add to social isolation. So the slide that I have here is that social isolation harms. Whether we're looking at the loss of intimacy, social connections, collective connections, or our existential place, if we are missing those elements in society, we are at risk of social isolation. And research has shown that social isolation is as harmful as smoking 15 cigarettes a day. And it has worse health outcomes than obesity and physical activity. How many of you knew that? When I first read this, I was saying, my, how are we missing this importance? I think we've always understood it, but COVID 19 really brought it to the forefront as we saw individuals who were disconnected because of physical distances, disconnected because that mask hid that smile. We had to, rely upon more upon eyes. And we know the value of the touch. We lost that. But I left this slide up deliberately so that you would absorb the impact of social isolation and how it harms. If I had asked, is there a danger to health and smoking 15 cigarettes a day, hands would have thrown up. Is there a danger to the health and with obesity? Hands would have thrown up. Do these impact mental health? Hands would have flown up. But simply talking about social isolation and loneliness, we are not as well informed about this. So I'm hopeful that this presentation will certainly highlight the importance of us understanding its impact. So, who's at risk when we think about social isolation? Who is at risk in our society? Well, we know that it creates psychological or cognitive vulnerabilities. When we're feeling that we are not valued, we're not appreciated, we're being left out, it diminishes our sense of self. And when there's a diminished sense of self, then we are subject to depression and other mental health uh, situations. We know, colleagues, I am so worried about the increase in suicide. When we are socially isolated, we don't have someone to talk it over with, then often, too often, we are faced with suicide as a solution. And for years, we said that Black people don't kill themselves. Sadly, that is not the story today. So we must be aware that social isolation and the inability to seek assistance and support is connected to suicide. And we want to be a part of the solution. There's training that you all can take advantage of called QPR, question, persuade, and refer. And what this means is that you ask the question, are you considering harming yourself? Are you considering killing yourself? Then you use that question to persuade the person that they are worth living. You let them know that yes, you are cared about. Someone cares about you. And then you move on to making a referral. And sometimes that requires that you grab the person by the hand, just as Harriet Tubman was reaching out, and you help them to get help. Who's at risk? Location. If individuals are in remote locations or they're in locations where there are not others like them, that places the person at risk. You've been recently placed in assisted living, or you've lived in your community for years. You've lost your spouse. You're now in assisted living, and you have the occasional visitor. That's an example how location can really contribute to social isolation. Your network becomes smaller. For whatever reasons, you move to a new location, or your closest friends are no longer relating to you. You've lost your job and your relationships were at work. These are examples of a network that has diminished, and it can result in a lack of social support. For non-English speakers who are in the US, often this can be an area of social isolation when you are not able to communicate effectively. Really important to recognize the networks may be different. And again, membership in vulnerable groups, LGBTQIA plus groups can be an example. Older persons can be an example of a vulnerable group. Communities with disabilities can be examples that you're not able to go to a function because the function has stairs and you cannot negotiate those stairs. You become a member at risk because you cannot do the things necessary. Think about your network of friends. Do any of these things apply? And might you be able to make a difference in their lives? So, who's at risk? I will continue with this. Again, living alone, that places one at risk. Yes, I know that there are those persons who prefer to live alone and they are cognitively sound. Those are not the individuals I'm speaking about. People who are living alone, who that is not their desired state. They are living alone because of the loss of a spouse, the loss of a child, the loss of uh, relationships. Living alone has high risk for social isolation. As I just mentioned, mobility or sensory impairment, really important as we think about how we are able to help a person who is experiencing social isolation. You know, if I don't hear well, that can be socially isolating because what happens when people have hearing loss and it is not acknowledged, you get a lot of nodding. Mhm, because people tire of asking you, what did you say? So you need to tune into the cues and realize that maybe you should speak differently or use your ability at signing. And certainly, I would hope that many of you listening are able to use sign language. But you know, we've always used sign language in different ways in the community. And so we've used it to really say, are you hearing me? And if we use our uh, body to show, so we really need to tune in to the person isn't hearing you. As a gerontologist, I have often gone and met with family members, and it's clear to me by their answers that they are not hearing me. So uh, it is not acceptable to say, oh, they don't hear well, and not engage in that conversation. It is more acceptable to figure out how do I engage them in that conversation. Sometimes it may simply be going and giving them a hug, or patting them on their face, or making sure that they know that you are staying connected with them. Again, mobility impairment can make a difference. I don't go out to the functions because I don't walk as well as I used to, or I'm in a wheelchair. And this applies to children as well. If they have mobility impairment, then we have to be advocates in the community to make sure that they have access to the facilities that we are using. We don't ever want it to be they couldn't participate because they did not have access. Many of the structures in society were built for individuals who have full mobility, but we can advocate to make sure that there are curb cuts, there are ramps that are available, there are resources in the community that can help to make sure that there's ramping where needed. I already talked a bit about major life transitions. You know, when the children leave home and they go off to college, while some parents are celebrating, yes, others find themselves having lost a major part of their lives because their lives had become caring for and about their children. Again, the death of a spouse, the death of a beloved partner, All of these are major life transitions. Retirement. People find themselves being socially isolated when they are retired. Again, some are celebrating and very pleased that they are no longer required for this daily activity called work. Others experience loss as it relates to that. Transition, socioeconomic status, when one can no longer afford to do some of the things that they would like to do. Changes in their status. Sometimes retirement brings a loss in income. Others experience this because of a loss of a job. These uh, life transitions can make a difference. And of course, colleagues, being a caregiver, major risk of social isolation is becoming a caregiver because freedom of movement, freedom of participation is really impacted by this. So, as we begin to think about the life transitions, we know that individuals are at risk. So, what do you do about it? And I'm going to talk a little bit more about it, but understand that, sometimes what happens when a person experiences a loss, we call them on their significant days, like their birthdays. But what about the other days where they need someone to touch base with them and check in? You know how often people check in with you during the immediacy of a loss. But what happens a month down the road? How are we showing up? How are we staying connected? That is our responsibility within the Black community to stay connected. So let's kind of talk about culture and social isolation. I talked a bit about social exclusion, but culture and social isolation are inextricably linked to our fight against racism. It is also linked to our fears and our concerns, but it's also uh, inherently a part of who we are. The victories in racism and oppression have often come because of social connectedness, staying connected. If you think about civil rights, uh, you often think about people marching collectively. It's not a solo march. If you think about Black Lives Matters, it is about staying connected on an issue, around an issue. So as we think about social isolation, it is incredibly important that we look at the context of our culture. We know that urban African Americans have a greater level of social and economic isolation. At least that's what the literature tells us. Sometimes I question this because I've seen people making a way out of no way. I've seen people networking with each other, where the literature misses this because often when we answer surveys, we don't always tell all of our business. We were trained culturally, right? Some things stay in the home. That's not other people's business. That's family business. So, but I do believe the context of social isolation and economic isolation poses greater risk, but there also may be greater strengths in our community that we need to lean on. We know among the Latina population, that there's a greater risk of depression as well, based upon the literature. We also know that LGBTQI seniors are twice as likely to live alone, more likely to be single, less likely to have children, and more likely to be estranged from their biological families. We know that these cultural dynamics are at play. and we should be mindful of those. But I also want us to always be reminded of the strengths, because one of the things our LGBTQIA plus citizens have taught us is the strength of caregiving, and how when we're left alone, we become resilient and resistant. We are not going to let society say that we have no value, we have no worth. So the cultural dynamics allow us to be resilient and resistant to societal influences. So, what are some of the protective factors? I know that you know this: having a support system and a network. So simple. Let's stay connected. Having someone who's doing a check in. You know, one of the things I know about working with older people, I know technology has become super important, and it has truly been a lifesaver for many during the pandemic. A lifesaver. When people have been able to FaceTime, Zoom, they've been able to see each other. But there's still that value of that card. Sending that card, thinking about you. Because the value of that written card is that you can pick it up at any point. You can read it before you go to bed. You can say, oh my goodness, you can put it up on your mantle next to your bed. You have an opportunity to revisit it with little effort. So don't forget to continue to send those cards of caring. Really important. I don't mean to be a Hallmark commercial, but those things matter with my experience. Uh, Religious and spiritual organizations, we know that the Black community has leaned on the Black church. And as this graphic states, this is our story, this is our song. The ways that we have connected with each other through our faith has really made the difference in so many lives. The pandemic disrupted it, but it did not destroy the connectedness. And I would urge you to make sure the individuals continue to stay connected through their faith-based communities. These are protective factors. They have been tried and true, that individuals who have faith communities are healthier because they don't experience the social isolation. And yes, I was talking earlier to my colleague before the call about the importance of good physical health. It is a protective factor, meaning that we must go get our regular checkups. And when we have good physical health, then we're able to help others through their crisis. So it's important that we stay as healthy as possible. Does it mean that we are going to be challenge free? No, it doesn't mean that. But it does mean that we have to be attentive to our health. And whatever our disease status is, we have to own the responsibility of better care so that we can be of care to others when we begin to think about the protective factors. So if we remain in good physical health, then we are more likely to be socially active and socially engaged. So these are areas of protective factors. And yes, I wanted to indicate, you know, human to animal interactions are really important. These are my sister's two dogs, and they continue to create a important space and place in their lives. Uh, Miss Gammons presented earlier in one of these sessions about human to animal interactions. Really critically important that Pets can be a way of bridging the gap when people are feeling depressed, they are feeling a loss. Really important that we consider human to animal interactions as a source of connectedness. Now, that's Max and Marley. As you can see, they are having a picnic on a picnic plate. And also, a sense of purpose is a protective factor, meaning that, the photograph on the slide shows that you can do things that maybe you thought were beyond one's ability to do. These are protective factors. Colleagues, I really want to fly a plane. I haven't found anyone who wants to trust me in this, but it's still on my bucket list. I want to be like Bessie Coleman and do that. It's a protective factor when you feel that you can accomplish things, whether you are a young person learning a new skill, learning to skateboard, or whether you're an older person who really is learning to play the piano at a later life, a sense of purpose, or whether you're going to be out there on the front lines with voting rights and getting rid of some of the really draconian policies that are with us, whether you're going to travel, a sense of purpose is really important as we think about mental well-being. So, how do we assess when someone is lonely or there? Well, there are scales that are out there that you can use to do this. And I'm not going to go over them in great detail, but I did want you to know that they're there and you can find them on internet anywhere. You can find them. That these scales will help you uh, to think about how do you begin to assess whether someone is experiencing social isolation or loneliness. The UCLA 3-item loneliness scale, really simple. And ask yourself these questions, or you can ask someone else these questions. How often do you feel that you lack companionship? How often do you feel left out? How often do you feel isolated from others? To the extent that your answer is often for each of these, then you would score high on the loneliness scale. You would score 9. But it's possible that you only score 3. That means that you do not have the likelihood of being lonely. So again, these are pretty easy to administer, but I would suggest that you engage in conversation. Engage in conversation. So if I were doing this assessment, and I ask the question, how often do you feel left out? And someone tells me, some of the time, then I might say, well, tell me some of the times that you feel that way. Again, I'm not a clinical social worker, but we all have skills of communication and dialogue. Really important for us to kind of think about this. The other scale that's often used is called the Lubin Social Network Scale. These are 6 items that you can also ask. How many relatives do you see or hear from at least once a month? All of us can answer these questions. How many relatives do you feel at ease with that you can talk about private matters? You can have a lot of relatives, but you may not feel at ease. How many relatives do you feel close to, so close to that you could call on them for help? These are the family questions. But we know family is not the only source. We also know that friendships are an important source. And so, considering your friends, one might ask the question, how many of your friends do you see or hear from at least once a month? How many friends do you feel at ease with that you can talk about private matters to? And how many friends do you feel close to such that you could call them for help? Again, the same thing is you score these, based upon your answers in looking at this. So, and the scores are really, talking about the frequency of these. So, if you based upon your scores, then you can receive a score from 1 to 60, and it kind of begins to give you a sense of the social network scale. Remember, I talked about objective isolation, meaning you can measure it. These are things you can measure. The others are perceived, things you perceive as isolation. So, as I began to come to a close, I wanted to talk to you about effective interventions. And I have Taraji Henson here because she has been focused on improving the mental health in African American communities. I strongly suggest, particularly, that you go to her website and listen more about how she feels mental health impacted her life, depression impacted her life. This is an example of something that you can share with younger people so they can get the sense that, being successful does not make you immune from mental health crises. I write about allostatic load. You all know it probably as John Henryism, where in the African American community, you've heard the old sayings that you have to work twice as hard. And so when we are having to constantly work harder to address racism, then it increases our allostatic load that makes us vulnerable for all kinds of health challenges. We talk so much about being resilient. Being resilient at what cost? Perhaps we should be resistant and not allow the racism to impact us in the ways that it does. So it's really important that we think about it. So some of the micro adventures, things that you can do. You can volunteer to help others. You can also get one-on-one professional help. If you need therapy, open the door for it. Support groups are extremely important because sometimes we think we're in it all alone. Not so. Somebody else is going through the same thing you're going through. And sometimes a support group is really important. It's not for everyone, but it's helped many. Sometimes it can be as simple as a hearing and vision test to make sure that you can engage in reading that you love to read, or making a shift to an audible book when you can no longer, your vision doesn't allow you to do that. It adds to it. Again, the use of technology and adaptive technologies are really critically important as we begin to think about how do we make a difference in the life of someone. When my mother suffered with Alzheimer's, she could no longer read, but I would bring audible books in and we could listen together and we could have the conversation about the book together. So there are ways, if you use your creative senses, that you can help individuals through this. Really important that you start where the individual is, that you are perceiving to be isolated, and seeing how you can make a difference. And colleagues, what I would say to you is when they say, I don't need all of that, give it to them anyway. Give it to them anyway. Because that's saying that you took the time to care for and about them. Macro interventions that are out there are community focused, having, as I talked about, built environments to make sure that individuals can live in an area that allows them access to the various opportunities in the communities. Sometimes, again, relocation is really important to address it. I know it's hard to be uprooted sometimes, but sometimes it requires being uprooted for the general health and safety of an individual. So, as we begin to think about macro interventions, it's critical to think about sometimes you have to change the environment when the environment doesn't change for you. So, closing thoughts here. I've done a lot of talking, and my preferred format is more engagement with you, but I do want you to kind of think about social isolation as being a serious problem in our community, as dangerous and threatening as smoking 15 cigarettes a day, as serious as obesity. The same thoughtfulness you give to these areas, I want you to give to social isolation. When we think about social isolation, we should think about staying connected through the good and bad, because it is something that we can change. We can make people connected. There's an old saying that um, you can take a horse to water, but you can't make him drink it, or you can't make the individual drink, but you can certainly create a thirst. And when you create the thirst, then you are engaged in social connectedness. So, my closing thoughts here is that you are the one who can make a difference. The photograph that you see, for those of you who are able to see, it's my mother and I. Uh, Mother is in assisted living, and I'm having cool sunglass day. Now, mother's not real happy about this day, but I'm doing it anyway. We are having a ladies in pink and a cool sunglass day. It matters when you really take the effort to stay together. Thank you so much for this opportunity, and I am just delighted to have been able to present to you.